Hi, we're back again today with Dr. Alan Widgerow, who is the CEO of Alastin, and we're going to be talking about their anti-aging products today. And last time we had you on the show, we talked about products to get rid of pigment, and there were so many people who were interested in that. And we kind of went down a rabbit hole and talked about anti-aging a little bit. So I'm glad that we were able to reschedule and do another one just to focus on anti-aging, because you have so many good anti-aging products. So tell me a little bit about your interest in anti-aging and how you got into all of this interesting science.
Thanks, Leslie. So always a pleasure to be with you. Enjoyed our last session. So as you say, we went down a rabbit hole, so it's time to elaborate a little bit. I have to say, as a plastic surgeon, I was always sort of interested in the anti-aging aspect of things. But over the last sort of 2 decades, I would say even before then, I was always interested in research, and research evolved or involved a whole lot of different things, including wound healing. And I mention wound healing because it's really the background of everything that I do now related to the products. The anti-aging came about really related to some of the wound healing aspects because there's a huge overlap between wound healing, as you know, which is the basis of all diseases and anti-aging. And it really came to the fore with wound healing for me when we had an expensive lesson about 25 years ago when platelet-derived growth factor was discovered. And the FDA had passed it for the use in diabetic foot ulcers, and we slapped it onto the wound, and within minutes it disappeared. And we just did not know what was going on, because here you had this beautiful therapeutic, and in 2 minutes it was gone. And then we realized that actual wound bed was full of corrosive enzymes and all sorts of destructive elements that had collected there over the years of the development of this chronic wound. In other words, a non-healing wound creates a whole lot of waste products that are very destructive to whatever we put on. And related to that, when we discovered that you have to do something called wound bed preparation before you apply anything on the wound, any therapeutic, you have to prepare the wound, decrease inflammation, try and keep it moist, encourage epithelialization, support the wound. So there were all sorts of things that came into this sort of gamut of wound bed preparation. And when I started looking at skin products, and when I got involved with peptides and started looking at the anti-aging and skincare, I decided, this is so familiar to me because this is a chronic wound we're dealing with. The skin is exposed every day to elements and extrinsic elements and the intrinsic of wear and tear. So essentially, maybe I need to look at this from the aspect of what collects here. If I look at this as a chronic wound, what collects over time? And when you say what got me interested in the anti-aging, that really clicked a button and said, okay, let's see if we can experiment in a completely different way here, try and define exactly what these elements are, similar to what we saw in the chronic wound. How do we get rid of it? How do we change the environment and then start doing our therapeutics or our procedures? And that's how TriHex technology was really born.
That's interesting to think about aging as a wound, because I know in cardiology, a lot of the aging of the arteries is like a wound, so it makes perfect sense. And they're both involved with collagen and elastin and all those things. So that does make a lot of sense. Well, the big question I want to answer for people today that I get a lot, I started a Reddit sub-community and people come and ask me questions. And the biggest question is, how do I know which elastin product is right for me for anti-aging? So you have a lot of good ones. And today I want to focus on your regenerating skin nectar, your restorative skin complex, the reform and repair complex, the HA immerse serum, and your C radical defense. So I thought that's a lot of products. I thought, let's break them into categories and let's talk about the peptide ones first. So the first 3 on the list. How does somebody decide between the regenerating skin nectar, the restorative skin complex, and the reform and repair complex? And let's imagine it's somebody like me in their 50s. They want something for their skincare routine. Which of these would be best for me? And I'm a dry, sensitive, non-pigmented, wrinkled skin type.
Right. So, and that's a great question because we get this all the time. And what we've tried to do is limit this, not have 100 different SKUs because it becomes so confusing with that. So each one of these has been directed towards a specific indication. So you talked about regenerative skin nectar. That was designed on the very basis of what I've just talked about now. So when I said, well, how can we actually treat a chronic wound and how do we actually distinguish or what do we use to treat a chronic wound? What I mean by that is if you're going to have a procedure done, if you're having a laser procedure done, or we're having chemical peel, or we're having anything that is really going to involve healing of the skin, we want to prep the skin before you do the procedure. So this was a new sort of element that we introduced, and this was the preconditioning element, is how do we prepare the skin or prep the canvas, if you like, so that when you do the procedure, firstly, you get the optimal output, you get the optimal outcomes, but you also have the experience that is better in terms of healing, in terms of tingling, in terms of dryness, in terms of all the rest of it there. So the nectar was designed specifically for that purpose. Essentially, use it 2 weeks before the procedure. What it will do is it will change the environment. So the old and the accumulated of the waste products that I talked about, we define those as being fragmented collagen that is broken down, fragmented elastin that is broken down, circulating blood sugar collects. There are all sorts of things that we can go into related to the cell itself with recycling and autophagy and ubiquitone proteasome systems. And basically what I'm talking to you about is really recycling and waste management, is how do we get rid of the old stuff, replace it with the new. Why is that important? Because the actual extracellular matrix where we have the collagen and elastin and the cells that produce the collagen and elastin, being the fibroblasts, are in continual communication with each other. In fact, the fibroblast rests on that collagen fiber and they have little points where they're attached called focal adhesion points, where there's communication taking place all the time. So if you do your procedure where you're doing laser and you denature or break off a piece of that collagen, the first thing that will happen is you'll get a message from the collagen fiber to the fibroblast to say, make more collagen, something's happened, there's been a piece that is broken off. And essentially, after wear and tear and years of sort of exposure to the sun, that situation breaks down. When you have fragmented collagen, the cell can't stretch out on the collagen fiber because it's small now. So the cell becomes rounded, and what we call rounded cell is the senescent cells not producing anymore. So what we're trying to do with the nectar is say, use it 2 weeks before. We've shown that within 10 days already, we can start showing that the old gets replaced, gets moved out, the old collagen fibers, elastin fibers, gets replaced with new collagen and elastin. So what that means is when you do your procedure now and you break off that piece, the signaling and the communication will take place very effectively. And that means a few things. Number one is the healing gets sped up. You can hope that you can assure that signaling mechanism is going to be improved. And with that, you get improved outcomes. So, right in the beginning when we tested these with the clinical trials and all the various steps that we go through, we found that even on the superficial procedures that patients underwent, they saved themselves 2 or 3 days in terms of the healing process, and the actual experience became that much better. So nectar was geared particularly related to procedures, and you'll see there are a few nuances in there. One of them being it's anhydrous. That means that it's not a water-based formulation, so it won't burn when you put it onto raw skin. It actually takes, really nicely. It's comfortable to wear. It has this beautiful feel to it. So for procedures and post-procedures where the skin is very vulnerable, that's where nectar is absolutely suited, and that's what it was designed for. When one's finished the procedure, then we move on to maintenance, and that's where we start talking about restorative skin complex. But I'll pause there in case you have any sort of comments on the nectar side, and then we can move on to the others.
I do. We use the nectar a lot in our patients, of course, whenever we're resurfacing them or wounding them. But I've also found it works well with Ulthera, which isn't even a wound, but it's also increasing collagen. And the way I explain it to my patients is that your cells need to talk to each other. And so they have to give these cell signals, and it has to pass through that extracellular matrix to get from cell to cell. But if you have all this old, clumped up, broken up collagen and elastin in the way, the cell signals can't get through. And then also you don't have room for all this new collagen. So I believe when you're doing something like Ulthera, where you're trying to make more collagen, you need to get all that old junk. It's like cleaning out your closet before you go shopping to get new things.
Yeah, exactly right. And that's the point. I so often give this analogy of gardening, that, if you start and you want to plant new sort of plants, the first thing you got to do is get rid of the weeds and take the soil and turn the soil. That's exactly what we're doing, is we're prepping it for this new growth, or this regeneration, if you will, of new collagen and elastin. And you can't plant a little seedling in the midst of a weed there. You've got to get rid of it first.
Right. And that's the first product of elastin that I became familiar with. That was
Right.
the one that was really life changing for dermatologists and plastic surgeons alike. And we all got really excited about that. And it's been a while, but I remember you had a publication that proved that if you use it 2 weeks ahead, you heal faster. Do you remember the name of that publication? I'll show it on the screen.
Yeah, so that was probably the one with Sabrina Fabi's group. I'm trying to think exactly the name of it now, but it was the trough. And why I'm hesitating is we now have nearly 60 papers and publications related to it. To try and remember the titles is getting difficult, but I should have it in front of me. If I can certainly look it up for you. And
No problem. I'll pull it. What I like to do is just go to Google Scholar and put your name in and see what you're up to, because you're always doing very interesting publications, and that's how I keep up with you. So I'll pull some of those that way. Now, here's a question. What if a patient buys the Skin Nectar and they use it for the 2 weeks and then they have their procedure? They still have a lot left. Do they have to switch over to the next one, or can they keep using the Skin Nectar until it's used up? I usually have them finish it before they switch. Is that okay?
absolutely, and there's no question that's what they should do. It's not going to do any harm. It can only benefit the nectar, and I've got to tell you that patients love it. It's very difficult to get them to stop it and to sort of convert them, because the feel is so addictive. And funnily enough, men who don't like rubbing things in and like to have these things absorbed very quickly after shaving, also they love using it. So no harm done at all. It has the trihex technology in, as well as the restorative skin complex that we'll get onto. It does have, anti-inflammatories and things that you would associate with surgery or with procedures. So it's not necessarily designed for maintenance, but it's not going to do any damage for maintenance. And you might as well get your money's worth and use the whole story until it's finished, and then move on to the next one.
Right. And someone like me, where I have underlying rosacea, I find that whenever I've used too many retinoids and I get irritated, it's a really good rescue anti-aging product I can use when I have retinoid dermatitis.
It's funny you mentioned that, because I've had a few dermatologists that say to me they really love using it for rosacea. It helps with the redness, and I think that may be niacinamides and maybe other things in there that are doing it, but it certainly is not the first time I've heard that about rosacea and nectar. Yeah.
Okay, so they finish the procedure and then they switch over to the Reform and Repair Complex. How is that different than the Skin Nectar?
Okay, so they will switch over to the restorative skin complex. I'll tell you about reform and repair in a second. In fact, reform and repair, maybe we should talk about that now, because both these products are designed for procedures. So what happened is the Skin Nectar we were using for superficial procedures and non-invasive, should I say, non-major surgical procedures. And then we started with, when we developed our body product, I had a call from Laurie Cassis, who's a plastic surgeon in Chicago, and she said to me, I've been using the nectar before my surgery and then using the body product immediately afterwards when I do body contouring surgery, abdominoplasties, breast reductions, etc. And to cut a long story short, we looked at this and I said, this is a great combination, but it's anecdotal at this stage of the game, and it's pretty complex to use two nectars and one body product and try and get the patient to understand where to use what. I said, what we need to do is actually combine a whole lot of things that we've learned from our products. So let's look at the nectar that we know is really good for preconditioning, is what we were just talking about now. Let's look at the body product that we use for overall body maintenance and skin tightening, which is great. But we also designed the body product with a peptide in that we'll probably talk about shortly, a hexapeptide 11 that actually stimulates autophagy. And in this case, we wanted to try and get rid of lipid droplets. As the fat breaks down, it releases lipid droplets. They're very pro-inflammatory. They're cause fibrosis and duration of the skin. And if you can get those out faster, then it really does improve things. So that was the body product. And then thirdly, we had also developed a product against bruising where we had stimulated macrophages to get rid of the red blood cells. And I said, you know what, it makes perfect sense. If you're going to do invasive surgery, let's combine all three of those into one product. And I'll add something for scarring as well. And then the patient doesn't have to worry about using one product here, another product there. You have one product that you use, and that's called Reform and Repair. And we started using Reform and Repair for all kinds of invasive surgery. So invasive surgery is one side. The other side that we use it for is also dermatoporosis that we can talk about if you like down the way. But that product is designed for invasive contour surgery because we're getting into the fat, we're breaking down fat, we're releasing lipid droplets. We want to get rid of those as fast as possible. We want to tighten the skin. We want to reduce bruising. So that goes onto one side of invasive surgery. We've done multi-center trials in 7 different centers showing the induration improvement, all sorts of things. So that's beautiful for that. So the nectar and the Reform and Repair are sort of surgical products. When we finished with the nectar and we've done a laser resurfacing, or we've done a chemical peel, and now we want to go on to maintenance, we'd go into the restorative skin complex. Where's it different? Its continuity is there because the trihex technology is in both. It's in the nectar and the restorative skin complex. But what we did with the restorative skin complex is we said, okay, what problem are we trying to solve here? Well, we're looking at most of the time at a face that's undergoing processes of aging, different processes of aging. Part of that is really a change in the fatty tissue in the face, that we get some fat atrophy, we get some falling down of the skin. And in fact, quite honestly, I think it's not even the deep fatty components. It may well be the dermal white adipose tissue that becomes fibrosed, and you get this thin fibrotic skin that starts thinning from early on. Is there something we can do to stimulate some of the fatty components there? And Leslie, you're going to find that this is the new regenerative organ everybody's going to be talking about for the next 10 years, and that's fat. It's got such a bad rap because, we try to get rid of it so often, but good fat is so regenerative. Bad fat, really problematic, creates these inflammatory mediators. There are problems in diabetic patients. But good fat, if you can transform old fat that is big and the cells are hypertrophic or swollen, and transform those into hyperplastic smaller cells, these are really good regenerative cells. They stimulate mediators called adipokines. One of them is adiponectin. Adiponectin, really good for barrier, for fibroblast stimulation, for a whole lot of things related to skin health. So we were really keen in doing two things with fat. Firstly, trying to replace it, not huge volume, but just replace it with healthy fat. And then secondly, if you do replace it with that fat, to see if we can stimulate some good adipokines from that. So within the restorative skin complex, with the trihex technology, you're recycling, you continue to change the extracellular matrix, but now you're stimulating part of that fatty component that you lose with aging. So that's where that anti-aging maintenance comes in. So you get plumping, you get some the smoothing of the skin, you get the wrinkles or fine lines, and there are components of the peptides that also deal with pigmentation. So it's a nice all-round sort of transfer after doing the procedure onto the restorative skin complex.
Okay, so if you're going to get some kind of procedure, you want to do the skin nectar for 2 weeks ahead of time, and then you want to switch over in the dermatology world, if you're not having surgery, over to the restorative skin complex. And since I'm not a plastic surgeon, that explains why I don't understand the reform and repair complex so much, because I don't do that kind of surgery. So we always use the restorative skin complex.
Right. And as I say, as a dermatologist, the one indication, reform and repair, and we've just published this December 2024, hot off the press, related to dermatoporosis. And that's the osteoporosis of the skin, the thinning of the skin, where you gradually get thinning starting from 40 years old down to 90 years old, where there's thinning of the skin. And we believe that a lot of that is due to this collapse of the extracellular matrix and the substance that supports these vessels. And rather than the vessels being fragile, the vessels lack support, and that's why they start breaking and bruising and all sorts of things and becoming fragile. So So the to reform and repair, which is a combination for the extracellular matrix remodeling and for bruising and for skin tightening, is really nice for dermatoporosis itself. So that's one condition as opposed to your body contouring surgery where that can be used.
So if you're going to do microneedling, or if you get fillers and were stuck with a needle a lot of times, I always like to think of that as microneedling in a way. What would be the best product to put on after getting fillers or microneedling? Would it be the restorative skin complex, or would it be the regenerating skin nectar? Because your skin's still tender, and so I kind of tend towards the skin nectar, but it sounds like both would be good.
Yeah, I mean, I can complicate things a little bit here as well. So we've got it divided into two. Are we talking about symptomatic relief, or are we talking about adjunct maintenance? In other words, stimulating collagen and elastin. So with some of the fillers, and it's interesting now because with Sculptura, we've done quite a bit of work with Sculptura as well, and we're starting to look at fatty components there as well. The perfect match for Sculptura is restorative skin complex, because there you're stimulating the collagen, elastin, but the fat as well. And the fat becomes a really nice kind of story. So as a companion to filler, the restorative skin complex is great. If there's pain and swelling, yes, you can use nectar, but we also have another product called Enhance that you may have seen, INHANCE, for injections. And that's where we actually discovered the anti-bruising. So what we did was, when we did the body product and discovered that we could actually make these macrophages active through the autophagic process against some of the lipid particles, we said, well, if we can do it against some of the fat, why can't we get rid of some of the red blood cells related to bruising? So we did a whole lot of tests with the Hex 11 as well, and with other components, where we developed this product and showed that we could stimulate, or we could quicken up or hasten the relief from bruising and decrease the bruising quite fast, and work with the swelling and add Tri-Hex technology, so that even if you don't have bruising, if you're having an injected procedure where you want to stimulate collagen and elastin, this is going to be an adjunct to that. So that could be a good one for using with the injections. But there's no harm in using nectar as well. It's absolutely fine. If for bruising though, Enhance would be better.
I'm a huge fan of Enhance, and when it first came out, I run into the edge of my desk all the time, so I always have bruises on my legs. So I tried it on one bruise and not the other, and it was shocking how much faster the bruise I used it on cleared. And I remember you showed me all the data and proved to me
Exactly.
how it worked. It's absolutely works. I like it in Miami, where people have all the little the purpura on their arms.
Right.
It works for that. But I think you're saying you can use it all over your face, and I've never done that. I've never
Yeah.
used it all over the face after
Oh,
fillers.
So when I say all over the face, no, really related to the areas that you've been injected in there. If you want to use it all over the face, then I agree. Either nectar or restorative skin complex, that would be better for that situation. But Enhance would be specific to the areas that you've injected. And you mentioned the bruising, all that, and that's fine. Dermatoporosis, part of that whole process is bruising, and that's why we put Enhance the products from there into reform and repair. So it covers that as well.
So I'm not a fan of people doing the derma roller at home and doing their own microneedling, but unfortunately, a lot of people do that. And then they put all kinds of things on their skin. It gets down those little holes, and you see granulomas and all these complications. So even though I don't think people should do that, if they are going to do it, it sounds like the restorative skin complex would be the thing to put on afterwards at home.
Probably, if you want to know the safest with any particular procedure, no question, nectar's there. It's designed for that. It's designed for open wounds, designed for healing, so you can't go wrong with nectar. If you're looking to sort of look at anti-aging and stimulation and a bit of plumping, restorative skin complex may be there. But if there's anything in terms of safety and healing, in fact, nectar, to be honest, and this is not the same situation, but the deeper you go with any of your procedures, the better the results with nectar. That's really what it's designed for, is when that skin is open, how do we speed up the healing process? And that's where nectar really comes into its own. The microneedling, I agree, people probably shouldn't be doing on its own, but yes, they are doing it anyway, and either nectar or restorative skin complex would be fine in that situation.
Okay, in an anti-aging regimen, where of course we're going to talk about your HA and your vitamin C and your retinols, which are important, but let's assume they're already doing that. Which of these, let's say somebody has a growth factor serum and they're really trying to find something better. Which of these they throw out their growth factor serum and replace that with in this list of products?
I'm so excited about our serums because each one of those have got sort of unique positives to them, a new sort of disruptive breakthrough. So our serums involved, so there's the HA serum, there's the Illuminate that we talked about last time, which is for pigmentation, and then there's the latest one, which is the antioxidant. And all of those have really special areas. Now, just in general, I would put serums on before you put the anti-aging. In other words, before the Tri-X technology, the first thing we put on is either the Illuminate or the HA mousse or the antioxidant, and then the others. But each one of those, so let's talk a little bit about each one. HA mousse, what's the difference with HA mousse? Again, back to the wound healing literature, and I remembered so well that when I was sort of involved with companies like Smith & Nephew and we're looking to develop new products, part of the topicals that we put on when we used hyaluronic acid was we were sure not to use low molecular weight hyaluronic acid because that was just going to irritate or increase the inflammation there. We know it's pro-inflammatory. And when I got into the category of skincare and all that, it wasn't that much, people weren't that aware of it, that low molecular weight HA is really pro-inflammatory. So I thought when we do develop an HA product, I really need to be careful about making sure that we have a high molecular weight. Well, how do you do that? And why are they including low molecular weight? Because the low molecular weight will be absorbed. The high molecular weight is going to sit on the surface of the skin. So they combine high and low and they say, well, the low will be absorbed and that's why it's great. Well, it's not great because it's pro-inflammatory. Okay, but then how do you get a high molecular weight? So we can get it on the surface, but my big challenge was to try and get the cells, the fibroblasts that make those HA and the keratinocytes that make HA, and see if we can get it to make high molecular weight HA, because then we've got a sort of sandwich. We've got the outside that we can apply, no problem, and then we've got the fibroblasts from the inside that are making it. And through a long process of investigation, firstly doing a whole lot of gene expressions to identify the peptides that would stimulate HA. And one of them was a proprietary peptide that I designed in 2017, this octapeptide 45, thinking that it was going to be fantastic for extracellular matrix remodeling because I based it on some amino acids from collagen and elastin, which it is, by the way. But what took me completely by surprise was the stimulation of the fibroblasts of HA, which was really fantastic. So then, so we had a few candidates and few peptides. Then we went back to the lab and said, now let's do what we call gel diffusion studies to try and identify exactly what is the molecular weight of the HA that is being produced. And lo and behold, we found that it was greater than 2 million Daltons. So this was a beautiful high molecular weight that the fibroblasts were producing. And we combined this where we had a known high molecular weight that you could use on the outside. That was pretty easy. But then we combine it with these that created the intrinsic inside molecular weight, high molecular weight. So it's probably, as I understand it, the only one on the market that is exclusive to high molecular weight production of hyaluronic acid. And what's the result of that is in the clinical studies that we did, we saw so much reduced redness and just it looks like you're putting out a fire on the patient's face because of this sort of not only are you moisturizing and hydrating, but you're actually getting this low molecular, you're getting rid of any inflammation there at the same time and redness. So that's the differentiation of the HA serum, that it's high molecular weight and works really nicely.
I think, many people talk about HA serums and if they're worth the money because there are many expensive HA serums out there. And most of them are just humectants. They just pull water into themselves. It looks good. You plump up right away and you look fabulous, but it's temporary and nothing long term. I think that your HA serum is the only exception to that rule, that it does other things because of this octapeptide 45. And there's a great article you wrote about how size matters that explains all of the science. And when I read that article, a bunch of light bulbs went off in my head because I'm always trying different products from different companies. And most of the HA serums that I've tried either upset my rosacea or I get little milia from them. And I didn't get that from yours. I didn't know why until I read that paper. So I noticed what you're saying before I knew the science of why that was the case. And I've had a lot of people talk to me about that with my patients too. So I think the moral of the story here is you're getting the skin to make better HA than we can put on the skin topically. And although you have HA in there, which is great and it helps plump up the skin, you're getting the skin to make its own HA, which is bigger and anti-inflammatory.
Exactly right. And that was the challenge, and that was really the excitement of it, is when we saw these fibroblasts producing this high molecular weight. It was really, that's beautiful to see. And you're absolutely right. If you can control in any situation, if you can control inflammation, not eliminate it because it's important for a short period of time in terms of defense and all the rest of it, but then if you can stop it, regeneration begins, and the entire, all the background that you talked about, milieu, acne, and in any irritation relates to inflammation. So anything we can do to reduce that is going to be beneficial.
Now, do you remember back in the 90s when Restylane wasn't out yet and it was only in Canada and some doctors were sneaking it into America, or at least in Miami, people were sneaking it in. And I would have patients come in with these terrible inflammatory reactions to Restylane. We didn't know why. And it turns out it was because when people were sneaking it into Miami, it would be in the trunk of their car and it would get hot and the HA would break into these little small molecular weight chains and they were inflammatory. So when I read your paper, I remembered that and thought, that's why.
So funny.
Yeah, do you remember that? We would see all those weird reactions.
Makes perfect sense. And it's the same sort of thing happened to sculpture right in the beginning. They weren't diluting it enough and became a really inflamed story. And until they got to this 8:2 ratio, it changed things completely. So also in terms of but for the Restylane, you're absolutely right. It'll break down into low molecular weight because that's how the body actually heals itself. When we have a wound and a wound that needs healing, high molecular weight will be broken down to low molecular weight. Why? It stimulates inflammation right in the beginning. It gets the healing cascade going. So it's there for acute healing to take place when you need inflammation, but not for when you're doing an anti-aging or you're doing a filler or you're doing anything like that. That's where you need high molecular weight, stable, low inflammatory processes.
Right. So now let's talk about the C radical defense, your antioxidant. I'm a huge vitamin C fan. There's so many out there. We've all been taught that they have to be a low pH of 2.5 or 2, but that stings people with rosacea like me. I noticed yours is not a low pH. How do we know yours is absorbed? And tell us what makes your vitamin C different than the other ones.
Yeah, this was, again, such an exciting project because one of the things that I looked at there, and quite honestly, I wasn't looking for it, but you talked about the cardiovascular and cardiology literature earlier on, and you so rightly pointed out that, look, they're also very conscious of collagen, but especially elastin. The major vessels in the body degenerate by lose elastin and lose the elasticity and lose the capacity to expand and dilate and all sorts of things. So cardiologists are looking all the time at, elastin related to the vessels. And I happen to, because I'm so sort of elastin sensitive and conscious, because it's one of the regenerating proteins that I'm so interested in, and that's the backbone of a whole lot of our technology, is that I look all the time for new literature there. And in the cardiology literature, I found a thesis that had been written in Canada where they were looking at trying to stimulate the elastin within the vessels to try and replace some of the elastin. And they were talking about using a combination of a sodium ascorbate salt and probenecid. Now, probenecid was there to stop the collagen formation because they didn't want too much collagen formation, but they wanted to stimulate elastin. So I thought, wow, this is really interesting that they're using that. And then I went into the thesis, and 2 sentences in a 50-page thesis really caught my eye because it said, as we know, ascorbate, L-ascorbate, the tropoelastin, the mRNA of tropoelastin is very sensitive to L-ascorbate. And I thought, really? I didn't know that. I mean, almost all our products have L-ascorbate in. And if there's a sensitivity, what happens? And they sort of implied that this is going to damage the elastin. But the sodium ascorbate salt of vitamin C seem to be conserving of the elastin. So I looked at this and I thought, wow, that's really interesting because for all these years we've been using L-ascorbate and all these, and that's where we use a certain percentage and 10 or 20% and the pH and protect it from oxidizing and don't use it twice a day and don't use it with retinol, a whole lot of things that we've been doing for years and years. And I thought, well, if we can use the sodium ascorbate salt, firstly, there's a sort of Cinderella, or rather a Goldilocks sort of dosage that you need, which is really small, and you don't want it higher and you don't want it lower, and they'd already done the work on that. Anyway, I took this to the lab, the sodium ascorbate, and I started testing it with products that had L-ascorbate in, very well-known products that had L-ascorbate in. And we used an ex vivo model. And the ex vivo model that I use, I may have mentioned to you last time, is I get Steve Cohen, plastic surgeon down the road, and a couple of plastic surgeons to supply me with the skin that they excise from facelift patients, because then I have photo-damaged skin as opposed to the other ex vivo models, which are done from abdominoplasties, which are not sun-exposed. And then they start applying UV light to make it sun-exposed. And for me, all those things just create a whole lot of variables that are not really good. So for the facelift patients, we're using the photo-damaged skin. It's a beautiful model. So we used that model and we firstly, I haven't gone into the way we formulated this, but the sodium ascorbate was one part of a whole lot of other antioxidants that were combined with it. But I was particularly looking at the sodium ascorbate part of it to see what it did in the elastin. And we tested it on the ex vivo model, and lo and behold, we found that the L-ascorbate had this sort of moth-eaten appearance of the tropoelastin. It wasn't these nice fine fibers. And the sodium ascorbate with the preparation actually had very nice conserved tropoelastin. That got us really excited. It looked like the ex vivo was going to work there. And in a nutshell, to summarize, we used a whole lot of well-known antioxidants as hydrophobic, hydrophilic, and the combination of that with the ionic and with the sodium ascorbate, we've put together a formulation. Then we took it to clinical trials and we tested it, did beautifully, did all the things you wanted an antioxidant to do, global skin health, pigmentation, all the things there. But we took 5 patients at random who agreed to biopsies, and we biopsied those 5 patients. And that's where the real sort of fun started, because 5 out of 5 patients, and in fact, we had this on the cover of the journal Cosmetic Dermatology, and in fact, I've published every one of those 5 biopsies, have got a huge simulation of elastining, like I've never seen before. And, we're using the new stains, MOVAT stains, so we can show early elastin fibers. This is not solar elastosis. This is new elastin that is being stimulated. And I thought, wow, this is not the sodium ascorbate alone, because they just talk about conservation of elastin. In other words, it's protecting it, but something here is actually stimulating it. And my guess was lactoferrin, and I know we've discussed briefly lactoferrin before. It's one of my favorite sort of multifunctional proteins. It's really potent in a whole lot of different ways. But I started testing it. I put the lactoferrin together with sodium ascorbate. So cut a long story short, that's the secret. We've got the IP by the combination of sodium ascorbate salt and lactoferrin. You have this huge stimulation of elastin. So now you have an antioxidant that doesn't need protection in a bottle, doesn't need this certain percentage, doesn't need that pH protection. You can use it with the retinols. You can use it morning and night. All of those went out the window, but you have collagen stimulation, antioxidant activity, and you have elastin stimulation. And by the way, we measured the antioxidant. That was important. We sent it to a company in Brazil that just does testing of antioxidants, and we sent it with the leading antioxidant from the market and tested ours identical in terms of its antioxidant efficacy. So that was the huge advantage here, was the stimulation of elastin.
And if right about which one you tested against, that one's only water soluble, and you said yours is fat and water soluble, so the antioxidant gets in the cell membranes and inside the cell. So yours is actually going more places than the other one, right?
Exactly. And we have surrounded it with a liposome as well, and it's stable and it gets in very easily, and it's none of the other problems that we talked about. And you're absolutely right, hydrophilic, hydrophobic, so we get it through both in both areas.
The other question I get a lot is if you can use vitamin C and niacinamide together, because sometimes with L-ascorbic acid, it's a problem using niacinamide, but you wouldn't have that issue with your sodium ascorbyl phosphate, right? Okay,
Correct.
So that's great.
Yeah.
Is there anything you cannot use at the same time as your C radical defense? Anything in your regimen you don't want to put it after? Like, can you use it after a glycolic acid? Can you use it with a retinoid?
We have not found any problem. Now it's been on the market for a reasonable amount of time. We would have seen that now. I haven't found a real problem of combining it with anything as opposed to, all the other, the previous. And that's why I mentioned retinols and all the rest. Peels, we've used it, in fact, after some of the peels. And I want to say that this is the only way to go, but we haven't had reactions and have had problems from it yet.
Okay, so we've talked about 5 products. They're all amazing. They all have great assets. So let's go back to my original question. Which one do you buy? Because we can't put a million products. We have to go to work. We can't just do our regimen all day. So let's say I've already done videos on how to choose between your moisturizers and how to choose between your cleansers and how to choose between your sunscreens. But this is harder, and I needed your help on how to choose between your anti-aging. So if somebody's dry and they have rosacea like me, I'm guessing that the regenerating skin nectar would be great because it's anti-inflammatory, or the restorative skin complex would probably be best for my needs if I only had to pick one. Would that be correct, do you think?
Yes, and I think the two obvious things here, firstly, is skin type. I won't talk about, you're the expert, and and you can use these in all skin types, so that's not really a problem related to it. The second one is age. Are these, how far advanced is the aging sort of process? If you're a young person that said to me, listen, I just want to spend money on one product and I don't want anything else. Personally, I would probably tell them to buy the antioxidant. Now, at this stage of the game, is use the serum and the antioxidants and the C radical, because as a young patient now, preventatively, if you're stimulating elastin, that's fantastic. In the older patient, I'd use restorative skin complex, but then you have all the ancillary surrounding that would be, great as you carry on. Okay, is there added pigmentation problem? You mentioned rosacea. Are there certain things that maybe we use nectar for rather than the others? So I think there probably are pretty good products for almost every indication that that comes up there, but they are unique and different, and I've tried to sort of design these so that we are answering a specific question rather than just a sort of me too moisturizing product.
Are there any of these that are better for somebody who's postmenopausal?
That's a good question, and I would probably look at the restorative skin complex purely because, with lack of estrogen and things, your fat component also gets affected with that, and I think that plumping and using the restorative skin complex would be great in that situation. I know that there are specifics that we look at to try and counteract the estrogens, but I don't want to mess around with hormones and anything like that. And I think the closest we get to that is the restorative skin complex, so I'd be happy to use that. Postmenopausal.
What if somebody's in their 30s and they have kind of oily skin and they have acne, but they want to do anti-aging and they don't want any kind of clogged pores? What would you choose in that situation?
Most of these that we mentioned are non-comedogenic, so I think they're not going to have problems. And if you combine the restorative skin complex with a retinol when needed, you would be absolutely fine with that combination. I don't think that's a problem. A lot of these things are trial and error according to your personal sort of skin sensitivities. As I say, they're all designed for sensitive skin. Funny enough, the lactoferrin that I talked about that is in quite a few of the products also seems to be a neuropeptide. It also seems to actually decrease and work nicely for sensitive skin. We've got niacinamides in some of them. And so there are components in all of them that would be advantageous, but with the restorative skin complex really covers so much of the maintenance that we're talking about so well that I would start with that and then see if they need any specialized serums. Again, I said if your patient says I just want to use one product and you're young and you don't have the pigmentation and all that, or if you want something that's going to cover as much as possible, the C radical is antioxidant, will cover a whole lot of things, but it doesn't have that trihex technology that I like you to go on to long-term maintenance, on.
So for my oily, acne-prone, no pigment issues, kind of early aging 30-year-olds, I kind of tend towards the HA Immerse serum because they like it's not heavy, it doesn't feel greasy on their skin, and And besides upping the hyaluronic acid production, does that have any other anti-aging benefit in that HA Immer serum? It doesn't have the trihex, right?
So it doesn't have the trihex, but it has the octapeptide 45. And to be honest, the octapeptide, no, not to be honest. I don't want to sort of preempt anything coming up, but that octapeptide is fantastic, and you're going to find new things where we combine those peptides.
You can't tell. We almost got a secret out of you.
You nearly did. You nearly did. But, I'm so excited about what's coming because we've got a whole lot of really exciting sort of combinations where we've said, these peptides, the Trihex technology is working fantastically, and some of the other peptides are working fantastically. What happens if we join hands? Put them together, will they work double fantastically? And I think that you're going to see that, we may have some breakthroughs there. Number one. Number two, delivery things, delivery mechanisms that are coming up. Everybody's getting excited about biologics, that there are exciting things about biologics that the things that are above the biologics that we can take in a synthetic form and actually use it so much safer and so much targeted and so much more effectively. That's where I think there are real exciting things coming.
Sounds like we're going to have another interview coming up in the future.
I have no doubt about that.
Now, if you are a man and you're shaving and you want to use your aftershave, you want an anti-aging and aftershave all in one, I tell people to use the regenerating skin nectar. So if they have any nicks or cuts, is that a good idea?
No question. No questions, not even competition with men, because they love the feel of it. You put it in, it gets absorbed quickly. They don't have to worry about rubbing and rub. Sometimes you need something that you rub for a while and you feel like it's going in. I think the skin complex is a little bit more like that. But for men, the nectar is it's a no-brainer. They love it. They love the feel of it. And it's doing, great things.
And then the 15-year-olds who are all on TikTok getting all this bad skincare advice, their moms ask me, what do I tell my 15-year-old to do? Sounds like the C radical defense would be the best bet for them because it's going to protect them from the sun.
I think so. I mean, it's a difficult one. This is a whole new ball game now. So, and I can't say to you we've tested on so many 15-year-olds, but that I would edge towards that. I think that the HMS is also great, as you said before. But
right. And again, we're in Miami where people are getting a lot of sun exposures.
Yeah.
So I'm in a little bit of a different world than some people. We really need to start young, protecting our skin here. Okay, so that's great. So
I'm sorry to interrupt, but that's the essential. You're absolutely right. I mean, let them do the sun protection first, and then add the little extras that are great. But just try and protect from that sun because it's just the number one aging source.
Right, and no sunscreen's perfect, and some sun's going to get in,
Great.
And so then you have that vitamin C there to help protect you if any gets in. That's my thinking. I'm starting to play golf, so I have to worry about this a lot. Okay, so let's go through, let's talk about some of your ingredients. We've talked about them a little, but maybe just a blurb on each one. First of all, you have a lot of peptides in your products, and historically, I'm not a peptide fan because they don't really absorb very well. They don't play well in the sandbox with other ingredients, and they'll inactivate things. You've solved all, if not, I think all of those problems in your products. And people can look up online and see your references and see your studies and everything. That when I say I don't like peptides, it's like I don't like peptides except the ones we're about to talk about because they're really amazing. So Trihex is one of the most fascinating of your peptides. So can we talk about each piece of the Trihex?
Yes, let's do that. And before we do that, your point's absolutely, well taken. Essentially, with the peptides, you have companies that sort of advertise that we're using 7 different peptides and making this into a, real good thing, or as opposed to these other guys that are using 3 or 1 or whatever the story is. We are extremely careful about which peptides we use, how we use them, and how they play together in the sandbox. And what I mean by that is if we test, for example, you mentioned Trihex technology. Trihex technology is tripeptide 1 and a hexapeptide 12. Now, well, that's great. Separately, we've got a huge amount of evidence on tripeptide 1. That's a very well-known copper peptide, etc. Tripeptide 1 or with or without the copper. Hexapeptide 12, less well-known. Probably the most well-known thing about hexapeptide 12 is that it's an elastin binding protein. But how do they behave together? So we spent a huge amount of time doing gene expression tests, looking at tripeptides separately, hexapeptide 12 separately, and then putting them together. Sometimes, and you've mentioned this, sometimes is they negate the effect of each other. In other words, they don't play nicely in the sandbox. They have just the opposite effect. And you put together a whole lot of peptides and you're getting nothing, if not, worse results. So the first thing that any company has to do if they're using peptides is make sure that the peptides alone do what they want, the peptides together do what they want more than what they do separately. And then when they're in formulation, that they're doing as much, if not more, in the formulation. And that's what we do with each of those, is the gene expression must validate all of the areas that I've mentioned now. So that's really important. Trihex technology, tripeptide 1. What does tripeptide 1 do? And this is where the whole sort of light bulb went off when I saw that tripeptide 1 releases an enzyme called MMP2, which is gelatinase. And the process that we talked about earlier about denaturing collagen, what happens when you do a laser and you fracture collagen, you break off a piece. The piece that is broken off is tripeptide 1. The tripeptide 1 stimulates new collagen formation, so we know that it does that. The piece that remains is gelatin. So it's gelatinous. So in the background of the extracellular matrix, when you've got this fragmentation of collagen, you're left with a gelatinous, fragmented collagen and elastin that you need to clean out. The tripeptide 1 releases this enzyme MMP2. The other name for MMP2 is gelatinase. What does it mean? It means it breaks down gelatin. So this is exactly what we want. We want it to break down the gelatin. We want it to start absorbing the collagen and elastin. And then we want to stimulate new collagen and elastin formation. And tripeptide 1 does all of those sequentially. So I talk about three things that are important with the tripeptide technology. Firstly, that it's targeted towards the extracellular matrix. We know that it's working. Secondly, that it's synergistic. In other words, that the two that I just mentioned now, that when you put them together, they work, really nicely together. And thirdly, that they sequentially active. In other words, it will first clear out the matrix and then it will stimulate new collagen and elastin. So tripeptide 1 is perfect for doing the extracellular matrix, cleaning it out, stimulating new collagen and elastin. And the hexapeptide 12 we used as thinking that it's a elastin binding protein. It will pull the new elastin into the right place and keep it in the right place and work great together. We've now discovered through the years of using hexapeptide 12 that it actually stimulates elastin as well. It doesn't just bind elastin, it stimulates the formation as well. So together they work beautifully in terms of the generation. We've also discovered a whole lot of other things about hexapeptide 12, particularly related to pigmentation. And that's why with, the patients that are on nectar and improve with the pigmentation, it's starting to explain things, because we found that hexapeptide 12 really started working very well in melanocytes and decreasing pigmentation there. So we've also discovered other things about hexapeptide 12, but together they actually are responsible for the extracellular matrix modulation or remodeling that we talked about, getting rid of the old, waste management, replacing it with a new.
And although they're both big peptides, it looks like the tripeptide 1 could be up to 800 Daltons. Is it true that when you bind it to your palmitoyl, the palmitic acid, that's helping it get in better? Is that one of the special secret sauces of your patent?
Exactly. So the palmitoyl moiety, which is a fatty moiety, will actually get it through the skin effectively. And the best way, greens tests and absorption, all that, I like to do the biopsies and see, okay, what's happening under the skin. Because if it's going to change the extracellular matrix, it's being absorbed, no question about it. So we do surround them with and you're right, the secret sauce is the palmitoyl moiety that gets it in very effectively. And then sometimes, even with our hexapeptide 11, which is also around about 600-700 Daltons, we actually put a liposome around it, depending on where we want it. So for the body product, we wanted it to get into the subcutaneous fat. Wow, that sounds ridiculous. But in fact, if you design a liposome less than 385 nanometers, and we designed it 180 nanometers, you can get it down the hair follicle, straight into the dermal white tissue and into the subcutaneous tissue. So there are various different sort of nuances that you can do from the delivery system perspective and from the combination with these different moieties that will ensure that you get it to the place that you want and absorbed effectively.
When I was at the University of Miami, they were doing a lot of liposome research, and they developed a moisturizer called LipoMoist that did exactly that. And, it was a long time ago, and they didn't know how to really sell the product, and it kind of fell apart. Universities aren't the best at coming
Yeah,
out with products.
yeah, that's my other hat at the university. Yep.
But I remember learning all about that. So your Trihex technology is in your ultralight moisturizer, your regenerating skin nectar, your restorative skin complex, and the reform and repair complex. Is that right?
Yeah, it's the backbone of almost every product, because wherever it's important for this extracellular matrix remodeling to take place, and that's almost everywhere, it's important to have this. And we're continually looking at that, because I think it's just it's a beautiful narrative in terms of this waste management and replacing the old and creating the new. You're always going to need that, and it seems to have great dividends in terms of skin health.
So let's talk for a second about hexapeptide 11, because that's my favorite of the peptides, because that upregulates hyaluronan synthase 2, and we talked about how it makes you make a larger molecular weight hyaluron. Oh, no, that was the octapeptide, right?
That was the octapeptide fibroblast, but you're absolutely right. And that was a surprise with Hex 11. Hex 11 we first discovered with autophagy. So when we were looking for, in fact, it was related to, quite honestly, to cryolipolysis, because in 2015, 2016, cryolipolysis was huge. But in between, we went through apoptosis and the cellular induration, and it was quite a fairly unpleasant sort of recovery in between sessions. And we said, is there something we can do to speed it up? And we discovered that it's probably related to the lipid droplets that I talked about earlier on. And we found a way of simulating. We said, how do we get rid of this earlier? And then I was studying autophagy, which is also part of the recycling. So autophagy is used in the body as a way of recycling large organelles, mitochondria, etc. But not only for large organelles, it's a coping mechanism of the body that if you have injury to a part, autophagy will be stimulated. The cells that aren't badly injured, it will supply some nutrients and help to actually get those cells to survive. The parts that are badly injured, they will help to absorb and to get rid of. And that goes so it will decrease senescent cells. It will look at the process of apoptosis. All this process of damage and death of the cells, it actually speeds it up and gets rid of things that could potentially cause problems. So it's very good from that perspective. And then lo and behold, when I was looking for autophagy and discovered hexapeptide 11 with the gene expression was really good for autophagy, I discovered that there's an equivalent of autophagy in fat cells called lipophagy. And that's where we used the Hex 11 and we showed it, and we did some beautiful experiments with macrophages and fatty cells, and showing that by adding them the hexapeptide 11, we could get those macrophages, the vacuum cleaners of the body, if you like, cells to absorb those lipid droplets a lot faster. And that led us into a whole lot of stuff with Hex 11. But you also said HA, and again, another surprise is when we were doing some of the studies in the gene expression, we found that in keratinocytes. So the octapeptide 45 was fantastic for fibroblasts producing HA, but the keratinocytes were producing HA under the influence of hexapeptide 11, which was also a new sort of area that we discovered.
Okay, perfect. Thank you so much. We've got great material, and we'll do this again when you come out. Let me know when the new stuff comes out, and we'll do this again.
Indeed. Look forward to it, Leslie.
Bye-bye. Happy New
Good
Year.
to see you.
Bye.
You take care. You too. Thanks a lot.